Leslie Cornwell, Certified Nurse Midwife with Empowering Midwifery Education. I apologize, I'm not at my beautiful, pretty self when you got some sick kids. I am sure you guys all relate. I am grateful to have my sweatshirt and my hair pulled up and my teeth brushed today. So we got priorities when you are a midwife and you're busy. So Whitney Elsesser is here with me. She's a midwife finishing her doctorate, and I love hearing the midwife stories of how they got going, what their direction is, why they're doing what they're doing, and then we just have some great conversations. So Whitney, thank you so much for joining me today.
Hi, thank you. So my name is Whitney Elsesser. I'm a certified nurse midwife. I've been practicing for almost 2 years now, and I was a labor and delivery nurse for since 2016. Everyone likes my "why did I become a labor and delivery nurse" story, so I can tell that. I thought I liked the ER, so I did a nurse externship in my local hospital. And I was about to go on my lunch break, and they have a safety nurse from the labor and delivery unit come down to the ER whenever somebody is laboring that comes in, doing their thing.
Yeah.
And the labor safety nurse comes down, and the patient's saying, "Oh my gosh, I think I'm having the baby now." So I threw my lunchbox across the nurse's station, and someone threw towels at me, and I ran into the room, and I watched this.
You're a born midwife. Yes.
Yeah. This 9-pound baby just fell right out. And I was like, this is what I want to do for the rest of my life. It was the craziest,
it's those moments in your life that just hit you, and you're like, the angels in the light are just screaming, "Oh!"
Yes, it was pretty crazy. So then I started practicing as a labor and delivery nurse. I did all my schooling there. And then I got hired onto the unit that I did my nursing school practicum on. And then I became a midwife 6 years later, and 2 children later,
Cool.
which was super hard and exciting. But yeah, I essentially became a midwife because I wanted to educate patients, and I feel like a lot of midwives are very passionate about education and women empowerment. So that's really why I did it. I did a lot of travel nursing, and I saw a lot of places practice that I did not like. So I wanted to be able to be the goodness in the world to women and help them with their journeys. And I felt like most of the time women needed education. Everyone's wondering why they have heart palpitations, and it's normal, nobody knows, and they just feel like they're being told everything's normal and not understanding why. So
yeah, well, and then they Google search it, and then it's usually a rare condition, or depending on who you're seeing, a lot of fear and anxiety versus education. So yeah, I think that's a very common theme with midwives is empowerment and education.
My favorite thing to do. So yeah, but now I teach a little bit now. So
yeah, I was going to ask, you're working on your doctorate. So what made you decide to pivot that direction?
It's kind of also a funny story. I just started. So my husband works from home and makes so much more money than I do with so much less education. So I started doing I'm in Pennsylvania, so I do a lot of legislative work with our CNM group.
Okay,
so cool. I'm super involved with that, and I'm also a part of the national CNMs, the PAC, the Political Action Committee, which I'm kind of new in both roles, but I want to get my doctorate so I can do more legislative things. It's not so much teaching. I do love teaching, but it was mostly so I can, I feel like I want to yell at people with more letters behind my name to be a little bit more authoritative, have more credentials.
Well, we need a lot of midwives being the midwives. I think too many people feel guilty when they're like, I'm a midwife, but I don't catch babies. People have this stigma in them. And I love talking to midwives that get oh, I can do that as a midwife. I didn't know that. And so it's really awesome. Do you want to stay more on a state level or federal? What direction do you want to go?
I don't know. I mean, I feel like Pennsylvania needs a lot of oomph in it, I've recently been looking at New Hampshire, and New Hampshire is very progressive with their midwives. So it's very interesting how the
just
different
state line, makes a difference.
Yeah. So I almost feel like I want to do a federal just so maybe we can have this a standardized midwifery,
Yes. We were just talking about that with my last meeting. There's quite a few out there, like transitioning more to like a public health midwife role versus affiliated with nursing, or like 5 different pathways, because it gets very confusing. Like transitioning to more of a cohesive, unified front would help all of us out greatly. Yeah.
It would. And then there's lay midwives and CPMs and CNMs and
CMs and
CNMs.
LMs, and then everybody's like, what are you saying to me? They have a hard enough time understanding what a midwife is to the consumers and legislature, let alone you try to teach them there's 5 pathways and there's 50 states, and they're just like, this is complicated. And I think that's what
one doesn't.
Yes.
Yeah.
We shoot ourselves in the foot for progress and expansion without a unified front. It's very interesting to see on local levels and on national levels how that opinion of we're just so different at a good chunk of the conversations. And I'm like, we all have a core belief in being, we just have a strength of community or a strength of birth center, or strength of hospital, or strength of legislature. Like we all have the common core intentions behind us.
Yes.
So Whitney, when will you finish your doctorate? I know they're usually about 2 years full time, if I recall.
December 22nd.
Oh, it's not like you're counting down the days or
anything. Yeah, no, not at all.
And then, are you planning on doing more independent legislator work, lobbying, or are you going to work with ACNM? Do you have any direction where you want to go with that?
I have absolutely no idea.
Okay.
Honestly, I kind of was like, I graduated nursing school, midwifery school, and I feel like it was very similar to nursing school. It's hard, it's time consuming, it's taxing on your life and your family. And I said, well, I never want to go to school again. So let me just get my doctorate and still just keep dying for another 2 years. And then my kids are still little, so they're not going to remember me being busy and tired, and just kind of knock it out of the way. So I was getting it just to get it, which is a hard reason just to get it, because I feel like I should have a little bit more motivation, because
I think a lot of people do. I think a lot of people want it, and they're like, okay, I just recently graduated. If I keep waiting and waiting, it'll just be like, oh, I don't need that, or excuses, or like you said, the kids are older. So no, I think it's very common theme that people say, especially when you want to do more higher legislature and more of a leadership executive role for movement change. It does help to have those credentials and that additional experience. Were you always from Pennsylvania, you and your husband, or have you been in different parts of it?
Yeah, so we did we met randomly. I grew up in Southern Maryland, and we traveled a lot. My husband was in the military, and we settled in DC. I had a baby, I don't know, a week or 2 before COVID. And I said, hey, DC is expensive. Let's not stay here anymore. Let's go back to see some family. And so we moved to Pennsylvania. So that's all that happened. And we've been here for, I think, like 3 years now.
Okay. Very cool. Very cool. What made you, I know you mentioned the story of the lady in the ER, but you did that for labor and delivery. When was it the pivot, or did you knew that very moment you were going to do midwife, and it like, no, was there another aha angel?
So where I am in Pennsylvania, I'm in Pittsburgh. The hospital that I kind of like grew up in as like a labor and delivery nurse, didn't like midwives very much. It was very much, if you wanted a midwife, go birth in the woods type of environment. And we had midwives there. They didn't get along with the maternal fetal medicine in the hospital, so they ended up moving. But I also had the mentality of like, who would want to have a midwife? That's crazy. Who wants to have an out of hospital birth? Like, why would you want to do all those things to you? So that's what I did. Like, that's what my brain was. And then I started travel nursing, and I went to Yale. And at Yale, they have a very great midwifery program. And I learned all these new things about labor and birth, and how my whole little bubble in my hospital wasn't not necessarily bad or true, but the conception of midwives wasn't appropriate, and how like midwives could practice. And then I went to another hospital, which I don't know if I should name. It was just the terrible hospital. It was the worst experience I've ever had in my life. I saw,
Well, just say it was a bad hospital. Yeah.
yeah, it was pretty terrible. And, I don't know, I argued with doctors a lot. And I was like, no, these women need more education, or like educated, and everyone needs educated. The doctors need to be educated. There's no practice that's appropriate. So I was like, maybe I do want to be a midwife because I can help, these people and these populations. And then so I kind of thought about it, and I was still like, yeah, I don't know if I want to go to school. And then I went to GW, George Washington University Hospital, and that was another really great experience. They also have a really great midwifery program. And they essentially convinced me to become a midwife. I love everyone over there. And they were like, oh, Whitney, you'd be such a great midwife. And I was like, yeah, okay, I'll do it. So I applied to midwifery school, and then I kept traveling while I was doing school, and I had my daughter. And then right before I finished my midwifery clinicals, right after I started working, I had my son. So it was a lot of work, but it was very, very much worth it. Like,
yeah, I had my two kids during midwifery school too. So people will joke like, oh, aren't you tired and exhausted now? I was like, oh, like the benchmark is midwifery school, having babies. Like if it's not topping that, we're fine. Like that's an intense part of the life. Yeah. Yeah. But to be biased, like if you're going to be pregnant, this is the best program and the best people to be surrounded by when you're pregnant. Like they completely understand. Yeah.
So true.
Yeah. Well, I think it's amazing that few people, one, will get outside of their bubble of comfort of a different community in a different setting. So doing the traveling nursing, but also being open to like, I do have some preconceived biases, or I do, like, half the time people put up a wall of defense, like this is the best way. Like I did a lot of traveling midwifery the last 7 years, and it would just, and that same concept where there are some hot messes out there, and there are some old school backdrop community hospitals out there, but they still think the backwards midwives that are cutting edge doing way better outcomes and circles around them are like, it's that stigma in the culture when you go to all these places and everybody thinks they're giving best care, and I'm just smiling because I'm like, well, so whatever, like it's the cultural norm of that area versus what is, we have all this evidence and standards, but a lot of these pockets just stay in their little voids of
like habit or something. I don't know. I don't get it.
Yeah. I think it's human nature where we resist change in general. We like the comfort of what we know. New fears the average person. So like, I think there's a clear difference between the midwives I see of like, they've always lived in the same hometown, they've always done it the same way, versus the ones that have traveled the world, the ones that have seen a lot of settings, have done traveling assignments. Like your approach to thought process and potential options of like care standards or what could be are completely different. Yeah, I would love to know if you have any other thoughts. Like I never really thought about doing the traveling labor and delivery while doing in midwifery school. How did that work with clinicals?
So I ended up just trying to figure out where I wanted to be for clinical. Like I had the opportunity to choose between DC, Virginia, or Pittsburgh, because I did lots of my labor and delivery experience in Pittsburgh. I know a lot of people in the area, and so I had some connections, and then I also had connections down in Virginia and DC because I went to Frontier, so it's the online program, and so I kind of just threw a fishnet out there and I said, hey, I'm going to be doing clinical around this time. Are you available? Are you available? Like, so that's how I ended up, getting my preceptors. So
very cool. Very cool. Yeah. And yeah, Frontier was at the Birth Center conference last week, and it's so interesting. Like, I wish more programs did a little more with like the Birth Center workshop and the business side. And like,
I don't do the Birth Center workshop anymore. It's not required anymore. They just changed it.
Bummer. I think it's important. I think that's the little, because few nurse midwives actually get exposed to home or birth center at any capacity unless they fight really hard for clinical sites, and they want that, and it's really important. Like I did it for my clinicals in 2012, but that was like a make or break of picking a program, was like from the very beginning. If you can't give me home birth clinicals, we don't have a conversation. So people have to fight really hard, but I would love to know like what you thought of Frontier and maybe some other schools and how you made the decision, because it helps a lot of people that are aspiring midwives. They get a little overwhelmed of all the pathways and all the schools. I get that question often.
So, I essentially picked Frontier because I'm pretty sure it's like one of the cheaper options for getting your degree. And then it was easier to either go faster or slower in the program. I think the fastest you can go is maybe a year and a half or 2 years, and then the longest you can go is 4. I
Mhm.
don't know. I don't directly quote me, but there is like a
Yeah,
big
there's
difference.
variations of pathways. And yeah, I know I
Yeah.
was impressed by the size of their program and how many people they have in the doctorate and how many people get the master's and continue. They had a presentation at the conference that
Yeah,
was quite
it's a
impressive
lot.
what they're doing. And I feel like they're definitely cutting edge. A lot of other places are more localized level versus like a national level. There's just a couple
Mhm.
other people really making that national presence. So.
It's pretty cool. In the very beginning of the program, you do a class where you look up all of your legislative things for your specific state.
Mhm.
And we kind of do presentations on it, and we see what everyone's local like area is doing. You know, I graduated with girls that are in Virginia, and I'm in Pittsburgh, and I'm looking at all the Virginia and in Georgia demographics. And it's very eye-opening to see how everyone practices differently, which is something I really like about Frontier, where it's eye-opening to see what everybody else in the country is doing, you know, with their midwifery care, with their legislative things.
Yeah.
So that's cool. And I also liked Frontier because they have a Frontier Bound, which is I'm not that crunchy, but it's kind of crunchy. It's very kumbaya, but it's um I don't know, when you get there, you get so immersed in it, and it's very much a good community and school building and a relationship thing. Like I still talk to 2 of the girls that I went down there with, and we were like best friends. Like one of them, our kids are almost the same age. We
Yeah.
see each other as much as we can, you know, not all the time. And we're like, oh, we need to plan a girls trip, but I feel like I made
You
lifelong
have a
friends.
special bond, yeah, when you're in that
Yeah.
military boot camp fight or flight together and you can relate and yeah, you have the kids together. I've got a couple as well that you get those special bonds with the students that are there, and it's harder online programs. So I love how a lot of them do it where they try to get you that extra support that's a little harder to do virtually.
Yeah. Well, Frontier, I feel like they make us like each other almost. They have us do lots of group projects, which everyone
Okay.
hates group projects, but also the mentality is everybody wants to go to midwifery school. Everyone wants to graduate. Everyone wants to get a good grade. You know, we're choosing to get an advanced degree. So, you know, 90% of the people are trying to do their best, and they put their best foot forward, and they're doing all the best work that they can. So group projects actually aren't very difficult,
Mhm.
you know, in the program. And then they do a lot with the DNP. You have a cohort that you go through with. So you do you plan your project, you implement your project, and then you do dissemination. And I've been with the same, I think there's 6 of us since like July. And I feel like I know all about all these girls' lives. We're like all best friends, you know, we're planning a
Oh.
big trip, and it makes a very good sense of community. Like I think Frontier is very good at making it so you don't feel like you're alone going through the program. And
Yeah.
we do introductions at the beginning of every term, and it feels like kind of tedious, but when you look back at it, it's like, oh, like I remember this person, and it's great. And there's lots of Facebook groups for each class that everyone does. And we all stay
Mhm.
connected on there too. It's really, I don't know, it's really nice. And then we celebrate everyone all the time. I know they're really good at making a nice community.
Yeah, a midwifery culture versus just a midwifery degree. Yeah, teaching you how to
Yeah.
the skills of midwifery. And that's what I think is so important is that paradigm shift of what is possible. And ever more in COVID and everything, everybody is feeling alone and isolated. So any little bit more that we can give relationships and community are so, so important for
Yeah.
everybody, let alone midwives. So
Yes. Yeah,
yes.
it's nice. And I think Frontier is like 50% of the midwives that like degrees, like 50% of midwifery graduates are from Frontier or something. Like they
Yeah.
churn out a
Yeah, they
humongous
were telling me like
amount.
2,500 in all of their all their doctorates and all of their program. I was blown away by the numbers, and they do a great job supporting all of them. Like, just even working really hard for clinical sites, like just going above and beyond what the average program does to take care of the preceptors just as much as the students, and taking care of the identity brand. And so, it's interesting. I mean, just with the timing of being at the Birth Center conference last week and the presentations, I was pretty impressed with the
Yeah.
caliber. So yes, I appreciate you greatly, Whitney, spending some time with me today. I always ask everybody at the end, any words of wisdom for someone, maybe an aspiring midwife or struggling or just can't find their zen. Maybe they found that not so fun place to work and they're like, maybe I shouldn't have been a midwife. Like, any words of wisdom you have for them?
I mean, I feel like everything is hard, so nursing school is difficult, midwifery school is difficult, but if you try and remember why you wanted to do it and your main reason for doing it, midwives have a very, I feel like there's all these different things that make it hard to be a midwife, but overall it expands your practice, and I feel like it makes you a better caretaker for women too.
Mm.
So I think trying to remember why you became a midwife and um, I don't know, I don't want to say like staying true to yourself. I feel like that's so cheesy, but
Yeah.
trying to remember like it's such a great community and we're all here to help you. And it is difficult, but we can do all the things that we put our minds to do.
Yeah. Well, and I think a lot of it is just the basics of choices. Like sometimes people feel so cornered because they're like, I have to have a job in the hospital or I have to work here because it's close to my family. And I was like, well, let's talk about the pros and cons with a lot of the professional development of just why did you become a midwife? Maybe it makes more sense for you to start a business. What are the fears? What are the stepping stones? And is that possible? Or maybe you do have to move for a little while till you can build that community you're looking for. Like sometimes I think people feel so cornered, like we have a high burnout rate, a high turnover of midwives because they have this image of what they're going to be in the healthcare system in their area or the places they've stumbled on for their job opportunities more in line with what they're looking for. So then they start stereotyping, well, this is what all midwifery is like, so why did I bother, versus knowing there are these gems across the country. Sometimes, I would love to say every town has the wonderful utopia midwifery places, but we have to create them. And how do we create them and stepping stones? So I appreciate you greatly, and I can't wait to see all the great lobbying. We desperately need people at the table and advocating internally for us. So thank you.
Thank you.